It's important to be screened for colon cancer because colon cancer is the second leading cause of cancer death in the United States. And colonoscopy is one of the few screening tests that not only diagnoses and treats precancerous polyps, but actually helps prevent cancer. And that's something that you have to take into consideration when looking at colonoscopy. The current guidelines require screening to begin at age 50. If there are family members who have been diagnosed with colon cancer, the screening should begin 10 years younger than the age of the diagnosis of that family member. There are about 3 to 5% of the colon cancers that are genetic syndromes where screening can actually begin in the 20s and 30s, but in general, the beginning age is 50. There has been some recent literature that is asking the question, when should you stop doing a colonoscopy? My response typically is that if the patient is healthy, that they should continue to have surveillance for colon polyps as long as they're healthy. Recent data says that over the age of 75 there may be some negligible benefit for colonoscopy, but I have patients in their 80s and 90s who I think if they were not surveyed during those 70s and 80s could have developed cancer that should have been prevented. So I would recommend patients always checking with their doctor to determine whether or not they are a candidate for a colonoscopy after the age of 75. Some of the most common symptoms that patients will have will be a change in bowel habits. There may be a change in the caliber of the stool. There will be rectal bleeding. But about 5 to 15% of patients who have colon cancer have no symptoms whatsoever. So it's important to know your body. And for anyone who has a change in their bowel pattern or notices something that is unfamiliar to them, they need to be checked. One of the most important things that patients can do in this day and age is, other than getting a colonoscopy, is to eat right. High fiber diet, low fat diet, those have been shown to improve motility and to help regularity, which is important. There are some things that you can do medication-wise, taking baby aspirin a day. There are some studies that show that reduces the polyp formation. A few studies have shown that smoking does increase your risk for colon cancer, so we always ask patients to stop smoking if they do. Certainly patients who have family history, we certainly want those patients to be checked earlier. And again, screening for colon cancer is the most important thing to prevent colon cancer. If you are diagnosed with colon cancer, it's important to know that 90% of patients can be cured in the early stages. So the earlier the diagnosis, the better the outcome. For those patients who do need to go on to colon resection, we do have some newer techniques that are much less invasive, less painful, and allow for quicker recovery. And those include laparoscopic colon resection as well as a Da Vinci robotic colon resection. And those are done in hospitals around the country, and the data is really positive. Not only does it improve your outcome, but the patients actually recover quicker.